Okay, hello. My name is Jeff Grever. I am the Community Engagement Program Manager for the Center for Clinical and Translational Science. Slide kind of gave that away, but yeah. So today we're going to talk a little bit about involving stakeholders in research and how that relates to research participation. Probably go talk about a few things that aren't specific to research participation and recruitment. But I think that even those things still sort of tie into it. So we'll get started here. So it's really important to engage stakeholders in research. I don't know if I'm saying something that you already believe in, or if this is sort of not really something you've done much with in the past. But one thing about stakeholders that they are experts. There's really nobody knows more about what their life is like and what it's like to live with a disease or to be in their situation more than they do. And so it's really important that we get them involved and we get their feedback when we're looking to help them in whatever it is we're trying to do. So if you're formulating a research question, you really wouldn't want to end up asking a question that they don't consider important or relevant. And sometimes the data makes something seem really obvious, but then we speak to our stakeholders, our community groups that we're trying to help, and we find out that really it's a little bit different than we anticipated. So that can really, it can really end up hurting your project in the long term if you didn't factor that in, whatever that is that you found out to your research question or to your protocol design. And so anyway, I just sort of want to put that out there first. So it's one of the things that we can find out is what the stakeholders, what their biggest priorities are when it comes to their health. I mean, do you think you know, and then have you asked them to ensure that you're on the right track? And so engaging with them helps the stakeholders get on board and advocate for your mission and goals too. If they feel like they've had some input, they get a sense of ownership, and they feel like they have an opportunity, and it empowers them to be a part of making a difference. So, I think that beyond just doing what is right and the right approach and what's important to them, you also end up having more buy-in from your stakeholders, from the community. And so hopefully maybe we can avoid some of the difficulties we sometimes come across when it comes to recruitment or retention. Or if we want to work with this community in the future as well, or this group of people, because especially some groups have sort of a cultural norm or experience that sort of they share a lot of information with each other. So it might not even be the same people that you worked with, but they have heard about you and might not have heard the best thing. And so we want to try and help create a positive experience as much as possible, because sometimes we're going to get those that type of feedback regardless of even if we are doing the right thing. But if we engage them and incorporate them into the design, into the formulation of the research question, and we let them know that we value their input, then we're at a better starting point there. So anyway, I want to say that, and it's not just, this is an important piece, I think. Stakeholders really need to be involved in all stages of the research process. Often we've heard about researchers that know they need to put together an advisory board, and I think that it's important to know that if you create your research question because you think you know how to solve the problem, you know what the problem is, you come up with your design, you get funded, and then you go to an advisory board and essentially check a box that you did it. It's very obvious to the stakeholders. They can see that you're not looking to change anything about what your plan is. You're just trying to tell them what you're going to do. And that really doesn't help them. It wastes their time. And that actually can end up being worse than not having the advisory board at all, depending on, at the very least, it's not helpful, and they can see that you really weren't looking for their feedback and their input. So, at the forming of the research question, I think that we haven't fully implemented this here at Ohio State, but we're trying to do at least a simplified version of it until we really get it on board. It's something called the Community Engagement Studios. And this is something that was developed at Vanderbilt. And what they do is they have a researcher come and say, this is what the kind of thing we want to work with, and this is sort of what we're thinking, but we'd really like to sort of run it past some people, some stakeholders that, so if it's diabetics between the age of 40 and 65 that are African American and, you know, come from a low socioeconomic status, for example, you would want to have a room full of people that fit that criteria, run it past them. And at that point, they're not research study participants. So this is sort of a question I get a lot, is they actually are consultants. And so it doesn't need to be sort of IRB approved like you need to get the IRB approval for recruiting research participants. So they're actually serving in sort of as a consultant, as an expert. And so it's not about recruiting them into the study. In fact, the Vanderbilt will tell you in their model, they say that's forbidden to do. If you have your stakeholders come in to serve as consultants, you can't then recruit them. If they tell you that they are very interested and want to be a part of it, you can give them the information they need to reach out to you afterward. But in that sort of environment there where you're doing the studio and getting their input, you don't want to be doing recruiting there. So, but you know, and they might even want to get involved as like a member of the research team. And I think that's really important to consider as well, is to try and get people, stakeholders involved in your research team. Depending on your protocol, that might look a little different from one project to the next, but you know, getting the study design put together is really important to get the feedback there as well. Back to the studio just for a second. The way that works is they get a room full of anywhere from like 6 to 12 people. They allow the researcher to do a quick 10-minute maximum, and they cut them off, PowerPoint presentation on what they're looking to do and some of their initial thoughts. And then the researcher is instructed to sit down and be quiet. And that's not always the easiest thing to do, but then a facilitator sort of takes over and really starts a discussion and helps the stakeholders in the room feel more comfortable. And the more comfortable they get to be with what's going on and they have a better understanding, then they can really provide some valuable feedback. And so I went to a training for these community engagement studios on how to conduct them. Vanderbilt actually did a real one, not just a mock one, at UC Irvine. And we went out there, and the first thing they did was have us observe this. They told the people in the studio that they were being observed for the process, you know, so they knew they were on camera, but the facilitator made them feel pretty comfortable pretty quickly. And it was just fascinating to hear, you know, the feedback they got. One that, at least in the work that I do, seemed obvious, although wasn't obvious to the researcher, was that they, you know, it was a study for African American adolescents. They went in Orange County, which is if you know anything about Orange County, there's not a giant population of African American people in Orange County, and so it was hard enough to find. They wanted children between 11 and 14 that were African American and lived in Orange County, and so about 6 girls, happened to be girls, but the study wasn't limited to females, and their mothers came with them, and the discussion was just fascinating. But one of the things that the young ladies had mentioned was that if you don't have somebody coming to my high school, that's how they were going to recruit, is have somebody at the high school that's African American, I'm very unlikely to even hear what they're going to say. You know, once they start talking to me, it's just not going to go well. And if they are African American, preferably female for her, because she was female, you know, then it might help break down some of those walls and those barriers that, you know, if I went in, and I would have to work pretty hard to earn her trust, and before I could ever maybe even accomplish that, the conversation might not even get there. And so what she was suggesting is we can get past all of those things for, you know, right out of the gate. If you have some race concordance on your research team that helps us with recruitment and even implementing the study, depending on what it is that you're doing. If you're doing interviews or if you're doing just a clinical interaction of any kind, sometimes that can be an important factor. And sometimes it depends on the topic too. It's not always important to have necessarily race concordance. It really just depends on what you're studying. So, but that's the kind of stuff that these types of groups can help you understand. So you might even be able to pitch that question in your 10-minute thing. Say, I'm curious to know a few things. One, do you think that we need to consider race concordance? Or, and actually it shouldn't probably be worded that way. It would be better to just say have an African-American person on our staff to help with recruitment. So anyway, that was just one example from one of those studios that I found valuable, and that researcher definitely found valuable, because actually the PI that was on that study, who wasn't the person there, was somebody else from the research team, is not African American herself, but had worked with African Americans for a long time. But given that this was working with adolescents, that became more important, and so she didn't think she was going to have that issue. And they said, no, this is going to be really important, especially in Orange County when we already feel like there's not very many of us. So that was really good feedback that helped. And it does, that's just one example. There's so many different things that we can get into, but I want to make sure we get through everything before I start firing example after example out there. So the implementation. So there's a lot of factors here that if you can engage your stakeholders as part of your research team, think about how they can be involved. So there's different ways, depending on, like I said, the different type of research and your different protocols. But if you do this successfully and you think about when the research funding ends and we have to pull out of there, is this going to be sustainable? Is this something that people are going to be passionate about? So, and when you involve your stakeholders throughout, they learn the importance of it, they understand what you're trying to accomplish and how you're trying to help. And if it's not like a simple program that they can learn how to run themselves and maintain it, if it's more of like an issue or a concept or something that as far as information that needs to get out to the community about prevention or making sure people get screened or whatever it might be, they know the importance level of it. And if they can't make it happen themselves, they'll be an advocate in their community to push for, we need this resource here, we saw it work and we need to make sure that that doesn't stop. So, or that more people get it, et cetera. So, and then obviously they're very helpful with dissemination as well. I mean, what is the best way to share results? And so, we want to make sure we don't think dissemination ends with getting published. So I think that we're moving past that. Most people consider that we need to do something else, but it's really important that we tell the people, at least the people that participated in our study, what the results were of the study. The College of Public Health, it might even be a 10-year-old video by now, but they put together a video where they interviewed people that had participated in research studies, and one of the biggest complaints that they had in the video was that they felt like they were just used and nobody ever told them what the results were. And if you think from a lay person's perspective, it's not easy to find a publication, and the right publication, and then to even be sure that that really scientific sounding title is the study that I was involved with. It can be very difficult for somebody who doesn't have a science background or any experience with healthcare. And so, what we want to do is incorporate their input as to how do we best communicate this, not only to the participants though, but to anyone who sort of fits that community or that group of stakeholders that we were working with. Because ultimately that information, whatever it is that you're studying, is very helpful, if we're for them to know about, and especially when it comes to prevention and help making sure that people understand what they need to know to be healthier. So, but people often just want to know what's the latest in research related to that as well. So it might not be like prevention or health information. It might be a drug that you're studying, and people just want to know what's the latest. I mean, myself, I'm a type 1 diabetic. I have enough of a healthcare obviously I do this job, but I also come from a medical family. I'm like, everyone else is a clinician. I'm the only one that's not. And so I can read through some of this more difficult stuff. But as a type 1 diabetic, I want to know everything that's going on with type 1. I want to know the latest devices. I want to know where they are with the cure and everything else. And that's not just because I have such a background and an environment around with healthcare, but people that don't have access to that or the knowledge also want to know. So I think we can really help if we understand what the best way to do that. And it really begins, the dissemination begins during implementation and continues through and past publication. So I want to make sure that I might be jumping ahead on my slides, but I want to make sure that I talk about, your average person who's not in research doesn't really understand how long this takes, right? So they hear about your research study, or maybe they get involved with it, but they have no idea how long this process can really be until you have your final results. So even if you've got the perfect dissemination plan when you're done, if they haven't heard from you in 2, 3, 5 years, they've sort of already decided that you're never going to tell them, because that's generally, they don't understand that things take that long in research. And so, there's several suggestions. I think maybe I do have a slide about it here somewhere, but let me just check. Yeah, I do. So I'll get there in a second. So anyway, so you want to, like we were saying, keep your stakeholders informed throughout the research process. It does help with recruitment. It also, in a way, it's if they're informed, that reminds them that they participated in the study, and they might mention it to their neighbor or to somebody else. Hey, this was really great for me, and you should do that. So if if it's been 3, 4 months or even a year since they participated, if they're getting regular updates, then they're more likely to tell other people, encourage other people. It also can help with retention. Regular updates. If you're interacting with your participants on a regular basis, or you're expecting them to have a follow-up with you, even if it's an emailed survey, like you really need, it really helps to remind them to do it. Sometimes they might miss the email, or it went to their trash, box in the email or whatever. So this is an opportunity for you to provide them with an update. And sometimes it's, there's things you can't share. I don't think I need to tell people in this room. You couldn't tell them everything, but hey, just want to let you know we're 50% of the way there. So they think, oh, okay, well, I thought they'd long forgotten about me and went off with my information, but they're not even done conducting the study. So that makes me feel better that I haven't heard from them their final results yet. So you didn't even really tell them much. You're just telling them we're making great progress. We thank you for your participation, or you can send out reminders and stuff that they should follow up. But it's really just sort of, if you can't share anything because you're worried you'll skew the data or sort of ruin something about your research study because you've shared too much information, or they would pass it on to somebody that might be a participant, and then it would bias your findings. Then you can just share generally, non-informative things, and just let them know that you're making progress or whatever. So I know that in research it's really hard to give anybody a specific, like, this will be done in 6 months and feel comfortable about that. But at the same time, I think saying, like, we're still going, and we're hoping that it'll be within the next 6 months to a year, or whatever it is you can share, they'll be happy to hear from. So, but I don't know if I finished the thought about the video, but it was something that they said consistently, is that they really want to hear about this, or else they feel as though they've been sort of, I think I did mention that. Anyway, I just want to make sure. Sorry, the getting to vote before I got to work was complicated, so it's sort of a little distracted with that. Okay, so and also, like, you continue to have a commitment, like I was sort of alluding to before, to your current project. But if this person really was engaged and felt like you had involved them, then they're more likely to either participate in a future study for you, or recommend that somebody participate in one of your future studies if they're not really eligible to do that and be an advocate for you. And that's never a bad thing to have people advocating for you. So I did talk about the communication a little bit. There's really no such thing as too soon. If you think about dissemination as communication, it sort of expands it a little bit. And I like to think of it that way. And so we've talked about, with some research teams, there's an opportunity to use Facebook. I think back in the day that wasn't a good idea because everyone who joins that group was like on a list of who's in this group. But Facebook has allowed groups to be completely anonymous. You cannot see who has liked a page or who is in the group, which makes it a little bit better. And then you can even turn off commenting, so nobody comments and then says, "Oh, I wish I wouldn't have done that," and now everyone knows I was in the site. So whatever it is, it's sort of like a newsletter, but something that pops up in their thing that, I don't know how many of you use social media, but I try to not use it, and I still find myself opening up a couple times a day. So it's something that they will see, that there's an update, and sometimes newsletters, I think they're a good thing, but they can get lost in email a lot because with the way technology's gone, people rely on texting and social media a lot more than they do on their emails. So if they're not in their email every day, it can get lost pretty easily. I don't think that it means you shouldn't do the newsletter, but sometimes you'll have a Facebook group, and instead of posting everything like all the time directly to the Facebook group, they'll create a newsletter and then just post that to the Facebook and say, we've got a new newsletter. So you sort of, I don't want to say cheating the system, but like you're getting the benefit of both, but you really spend your effort towards communicating with the newsletter, something like that. I think it's, like I said, we wanted to thank you again, and we're about halfway there is the kind of thing, if you're worried about releasing information that you really shouldn't, to keep from biasing your research. And you can, sometimes it's just good to share related health information or other opportunities. If it doesn't impact your research, it's not a bad idea to say, there's, if you're doing a nutrition study and it doesn't hurt the results to share that there's a food market in their community that they should attend. Obviously you don't want to bias your results, but if there's opportunities to share other information that they would find valuable, that's also another way to sort of keep them engaged, and so that'll help you in the long run. And then again, I touched on this, the sustainability. Stakeholders who understand the research better are more likely to continue to implement a program or advocate for more resources related to health concerns once the project is complete. So it's important to know who your stakeholders are. So we've had questions like this, but I work in a lab with mice. How would it help me and my research team? And so I have this little note here as one of the examples I have is there's a researcher here at Ohio State that was working with facioscapulohumeral muscular dystrophy, and he works with genes, and there's a gene in this disease condition that produces a toxic protein that causes people to develop the FSHD, and so if they can shut that off and stop producing the toxic protein, then they hope to cure the disease. So he was at a conference sharing this information, and then spoke with somebody who actually lives with the disease. If you're not familiar with it, and I wasn't, but some of you very well might be, one of the worst issues that people will deal with is that they lose the function of their arms. And so she came up to him after his presentation and said, I appreciate you're going for a cure and you're trying to solve this. That's really important. But to be honest, I've been waiting for that for a while, and I'm worried it's not going to come before it can help me. If you could just give me my right arm back, you'd change my life. I could brush my teeth. I could comb my hair. I don't need anybody to help me with that. That's all I really care about. And he thought about it, and so I guess the example was told to me, so I assume these numbers are accurate. But he had about 12 mice he was working with. He added a sort of a side project of 6 mice where he just focused on the right shoulder. And as it turned out, he actually made some real progress with the right shoulder, which then helped inform how he should approach the 12 mice for the sort of home run cure thing. So it not only did he get closer to what was important to her as a stakeholder, but he also helped his own goal, which was that curative solution, to progress a little bit by taking into account her feedback. And so, I thought that was a pretty powerful example of somebody who works with mice in a lab can really benefit by talking with people who actually live with the disease or condition. So sometimes I hear, but my research is focusing on a better diagnostic test. How would it help me and my research team to talk with stakeholders? Well, if the focus, and I heard this as an example thrown out in a meeting from one of our more experienced researchers. He was just genuinely interested, like, well, if you're just focused on something that's sort of within the medical community and it doesn't really affect the patient very much, then why does it matter if I talk to the patient? I said, well, I actually think you're thinking about your stakeholder wrong. Because his example was a new way to diagnose an ear infection, which I'm not sure we really need, but that was just what he threw out there. So he said, is there, what are we doing there? We're talking to the patients. They don't really care. They just want to know whether or not they have an ear infection and that you get the prescription. And I said, that's absolutely true, assuming that you're not doing something that is putting the patient in, some sort of pain or discomfort or inconvenience or it costs more, then I agree the patient really doesn't care that much how the doctor diagnoses it. But imagine who actually has to do the new way of diagnosing the ear infection, and that's the urgent care physician, right? You don't often go to the hospital to get diagnosed with an ear infection. The person who sees the most of that is probably the urgent care physician out in the community. So if your solution is they have to come in at the hospital to do it, then it really isn't going to be very helpful. And so that physician is your stakeholder. They're an urgent care physician who sees way more ear infections than the ED, assuming people didn't wait too long to get diagnosed. And so, that might be something that the kind of feedback you would get from thinking of a different type of stakeholder in that example. So, it's not always necessarily just the patient. It could be also the patient, depending on what you're studying, again, like I said. But, you want to think about who your stakeholders are across the board and see if you're on the right path and so forth. I've heard that my research isn't community-based participatory research. Why should I worry about engaging with stakeholders? I've heard that before too. And really, the way I see it is any research that intends to improve human health in some way is research that should get input from its stakeholders. If you submit a research grant that can show that you already are aligning with your stakeholders' priorities and have incorporated their feedback, you're ahead of the game. So if your application says, I'm going to work with the community, how does that look and compare to somebody who can put in a concise paragraph, I've already met with them, they've agreed to help me, and this is how they've changed my research question. Or this is the type of feedback that I got from them and we have incorporated in these ways. That is going to look to me like, well, I don't have to trust that you're going to get these people on board, get them in a room and actually do this and just hope that happens. I can look at this person and say, they've already done it. And so it's not only a good idea, but we know that the community's on board, right? And they've had some input in this. So if you think about it from that perspective, it can actually, be another benefit to you as a researcher. So, as the community engagement program, the CCTS, we offer a lot of different ways to support. Some of it is helping you put together a community advisory board. We have a lot of partnerships in the community with various groups. We are offering something new. We're finishing up our first Community Scientists Academy. What that is we are taking people that don't have a science background and teaching them the basics of how the research process works from start to finish. And the goal there is that we can have a database of people that have gone through the program that have a slightly better understanding of how research works, so that when they are on one of these community advisory boards, they can provide stronger, better feedback. I've seen, even in the example, community engagement studios, where a researcher is sort of staring blankly at a person and saying, why can't you just do this, this, and this? Well, they're thinking in their mind, well, you don't understand all the things that have to go into research sometimes. And so they just sort of really have no intention of following through on this because they think this person's just doesn't get it, right? So if they understand the research process a little better, it might be easier for them to tailor that same piece of advice, but they understand the process a little better, so they might be able to say it in a way that really starts to connect with the researcher, and the researcher can say, well, it might not quite work that way, but I think we can do this. And so, then you're working together, and so you come up with something that improves your project. So we are partnering with the Connect and Collaborate grants for our CCTS community engagement pilot grants. If you're not familiar with OSU's Connect and Collaborate grants program, they offer it, I want to say, once a year, but maybe twice a year. I got to double check. We're new in this, so we just went through and already had the LOIs come in this fall. So, and people have been invited to submit full proposals, but so you'd have to get on the next one. But it is something to consider. You have to have an established community partner, and they have to be committed and willing to also contribute to sort of a matching program. I forget what the exact match is, but the grants this year were as much as $70,000, and then your partner would have to do a 50% match, and I think half of that would be a cash contribution. The other could be like FTE or something like that. But anyway, it's definitely worth looking at. It's a strong program. We're just one of the stewardship partners and the way that it works is you submit your idea, and hopefully it's in line with what all the stewardship partners have laid out there, or at least some of them have laid out there, and then you get like 3 or 4 stewardship partners that come together and say, I'll give this amount, we'll give that amount, and they ask you to submit a full proposal, and they might tell you to change a few things if you want us to follow through with funding that, our part of it. But it's a really great process. It is a little bit lengthy, but it's been a very, very nice project, and helps you make connections in the community too, since that's one of the requirements. So we also do Science Cafe. Well, we're about to do our first one of these too. The Science Cafe, if you're, some of you may already know what that is, but it's basically an experienced researcher that can go out to people in the community that are interested in their topic area, and they want to know what's the latest findings in research. What's some health information that I should know to take better care of myself. And so our first one is, I don't know if any of you know Dr. Josh Joseph. He's an endocrinologist here at Ohio State, and we're taking him to the chat meeting in Whitehall, which is run by the Franklin County Public Health. They run that that meeting once a month, I think, or once a quarter. Anyway, November 9th is our day. So, and he's going to go and talk about his Life Simple 7 is what it's called. And they're basically your numbers that you need to keep in check to stay healthy. So, like cholesterol and blood sugar and A1C. And so forth. So OSU Extension, we're forming partnerships with OSU Extension. So if you're looking to work with anyone and you want to get out into a certain community, they can really help, and so we can help make that connection with the Extension educators in the community you're working in. We have just general community engagement in research and stakeholder engagement consultations. That would just be sort of a one-on-one with me, and we could talk about the things that you are seeking assistance with, and we can talk about how to address those. If it's not one of these on the list, we can see how we can work with you. And then we do have the Appalachian Translational Research Network that we are a part of. This is a research network that is formed by I think it's 3 or 4 CTSA. The CCTS is funded by the CTSA award. 3 or 4 institutions that also have a CTSA center like ours, and then several other colleges and smaller hospitals that are a partner, that have formed a partnership or a network. And so we just had the annual summit in Kentucky at the University of Kentucky in September, but Ohio State is hosting the next one in 2019 in the fall. So if you're interested in working with rural populations, and in particular the Appalachian community, you should make an effort to be there. It's a really great opportunity.